Hello, good evening, everyone. Happy New Year. I hope that you can hear me. It's Thursday, and we are back on our Facebook Live on nursing prioritization and delegation. So again, for tonight, we're gonna have some questions that I'll be discussing with you, and of course, let me welcome some people for tonight first. Okay, so let's have the following people. Okay, so let's see. The latest ones who just came in is Yay Nancy Esther Brown. Okay. So we have Amor de Guzman. She's also watching us right now. Okay. We also have, who else do we have here? Chica Anya, Mulo Hadera, and Jen Ramos Peña. So she's also here tonight. Joanna Manalang, Happy New Year also to you. Then we also have Desa Ogbuihi. Okay, so I hope that I pronounce your name correctly. Also, we have Evodia Chumbon, Angelica. Okay, and then the rest of the people earlier, I already gave a shout out to you guys. Your names appeared. Okay. Um, okay, so we have a very nice message that just came in, and this is from Desa Ogbuihi. So she said, I just want to say thank you so much for your lectures both here and on YouTube. So I passed my NCLEX exam and I got lots of prioritization by your lectures, but your lectures gave me a strong foundation. So thank you and God bless. Thank you very much, Dessa. So you're joining our session every Thursday and it has helped you a lot. So I'm very happy about that, that you finally passed your NCLEX. So hopefully your other classmates will follow also. Okay. So very good. Okay, so that's really very nice. Congratulations to you, Dessa. So I'll welcome some other people also later on. But before anything else, without further ado, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been a nurse educator for almost 25 years. I have been helping students pass their licensure examination, and also I am a nursing faculty. I have been teaching also students pass the nursing program. And of course, I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. And I also have a published book in Amazon. So the title of the book is Simple, Fast, and Easy NCLEX Review. It's available in Amazon and also in the Philippines. And if you want to purchase in the Philippines, you can email Matus Nursing Review Academy at gmail.com. Okay, and I know that a lot of students found the book really very helpful. And so please, if you like the book, guys, make a comment. Let your classmates know what are the good things that you will find very helpful in the book. Okay, so that's it, everyone. Okay, so what's our agenda for tonight? Of course, Happy New Year, everybody. And of course, our wish for this year is that more positivity, hopefully, despite the pandemic that is going on. Hopefully, this will be over. Everybody gets vaccinated. And of course, we have to stay positive and just really stay home as well, because we need to protect our loved ones and other people also, especially our vulnerable population, the people that who, if in case they get COVID, they may develop complications. Our senior population are frail patients, so we need to protect them, and that's why we need to stay home. We need to avoid crowds as much as possible so that we are able to finally fight this pandemic. Okay, now also. Today is a very historic day because we have the announcement of the new president that we have for this country, President Joe Biden. So hopefully we all move forward and towards healing, so that we address all the issues that are affecting our country at this time. Okay, so let's go to our agenda, everyone. Okay, so number one, we have, I want to show you this photo. So this is our motivational photo of the week, and this was sent to us by Kay Toranzo. So Kay Toranzo was my student before, and she passed her NCLEX-PN, and now she is reviewing for her NCLEX-RN. So hopefully, Kay, I wish you good luck in your pursuit to become a registered nurse. Okay, so another one that we have is, okay, so hopefully you can see that. That's the workbook. And when I send out the workbook, also everyone, it comes with a nice bookmark, my message also to the student, and some words of inspiration, because preparing for the NCLEX exam is not only about knowing the concepts that will come out in the NCLEX. It's not only an intellectual preparation. There's also emotional preparation involved to make sure that you have the psychological preparation, and you have to be motivated and inspired to pass your NCLEX examination. Okay. All right, and of course for tonight we have the free 90-day online access NCLEX review. So last 2 weeks ago, I guess, we had a raffle of the person. We took a video of that raffle drawing. The person who made a comment in the Facebook Live will be entered into a raffle, and then we'll pick your name, everyone. So after this session tonight, keep posted, because we'll be posting the winner of our free 90-day online access NCLEX review. Okay. All right, so I know everybody's excited about that, to have an access, for 90 days on our NCLEX online NCLEX Academy. Okay, and also everybody, if it's okay with you, if you can share or subscribe to my channel in YouTube. If you're watching in YouTube, please subscribe, because that will allow you to keep updated and be able to watch the latest baby videos that we have for this program. Okay, so let's see what's going on in our chat room, everyone. So there's a lot of kind of like familiar people that I know, that I worked before, people that I know who are watching right now. So Marilyn, okay, she's my great manager before. So hi, Marilyn, how are you? Ivy, Nicolas, also. We have Walnut Dennis, okay. Chon Nads is also watching. Cecilia Doctolero, Cadiato Chawali, MJ Enriquez also. So thank you for being here tonight, everyone. Okay, so we have prioritization questions for tonight, and then also we have some clinical skills that we are going to review. And of course, we will finish our discussion for tonight with delegation. Okay, and then after that, let's find out, or let's discuss the rationales for the questions that I'm presenting for tonight, everyone. So hopefully everybody's ready, because I'm gonna have the first question for tonight, and this is going to be about prioritization, everyone. And then after that, we will have some clinical skills, as what I have said. Okay, so let's have the first question, everybody, and then when you put your answer, I would like you to put your rationale a little bit, so that at least your classmates will be able to find out how you arrive at your answer. Okay, and then also if you can put your location, everyone, if you are in the United States or if you are international, so that it's exciting to know that we have students from different locations. Okay, all right. So the first question for tonight, everyone, is going to be this is not actually prioritization. This is actually one of the most common questions that you will encounter in the NCLEX. It's all about cohorting patients, or when you have patients who have to be in the same room, which patients are you supposed to put together? Okay, and you usually have these kinds of questions in NCLEX. Okay, all right, so let's have the first question, everyone. So the first question is, which of the following clients may be assigned in the same room for a client with advanced lung cancer who is receiving chemotherapy? A, the client with leukemia who is scheduled to undergo bone marrow biopsy. B, the client with osteomyelitis due to a stage 4 sacral pressure sore. C, the client who has generalized rashes due to an outbreak of herpes zoster. D, the client with fever, cough, and chills due to a flu infection. Again, I'm going to read the question. Which of the following clients may be assigned in the same room for a client with advanced lung cancer who is receiving chemotherapy? A, the client with leukemia who is scheduled to undergo a bone marrow biopsy. B, the client with osteomyelitis due to a stage 4 sacral pressure sore. C, the client who has generalized rashes due to an outbreak of herpes zoster. Or D, the client with fever, cough, and chills due to a flu infection. Okay, all right, so from Florida, that would be Vibrant Rose. Okay, we also have Nancy Brown is from the USA. Memi Lawal is from Omaha. Very good. Kadiato is from New Jersey. Yay Nancy Brown is from Minnesota. Na OC, she's a top fan and she's from Albany, New York. California, MJ. Chonas is Philippines. Okay. All right. So, put your answer, everyone. Why do you think A, B, C, or D is the answer? So, this is one of the most common types of questions that you will have in the NCLEX, and usually it has something to do with infection control and also maybe another reason as well. So I'll be explaining that. Okay. So the answer to this question is going to be, okay, so let's see if you have your answers, everyone. Put your answer A, B, C, or D. Okay. So the answer, everybody, this may seem like a very easy question. However, in the NCLEX, always remember that be careful with easy questions because you want to make sure that you know the answers to the most common questions that most new graduates know. Okay, so the answer to this question, everyone, is going to be letter. Okay, let's see if everybody got this question right. Yes, correct. The answer is going to be letter A. All right. Why is letter A the answer to this question? Letter A is the answer because I've seen that some of you put in the rationale here that a patient is most stable and don't present any infection. Joe Balsky also said that both are immunocompromised patients. So definitely. So that's why when you're assigning patients in the same room, you really have to make sure that there is no cross-contamination. Make sure that we do not transfer infection from one patient to another. And we need to be very concerned about patients who we know have an immunocompromised condition. So for example, somebody with advanced cancer who is receiving chemotherapy is immunocompromised, and then you have letter A, you have to put patients together in the same room who are similar, having similarities, especially when it comes to being immunocompromised. Okay, so that will be your letter A, because letter A is a leukemia patient, and we all know that one of the things that happens in leukemia is a low WBC count, okay, or neutropenia. So this patient is prone to infection. Remember the three hallmark signs of leukemia. You have anemia, bleeding, and neutropenia. Okay, so meaning this patient is prone to bleeding, infection, and anemia. So those are the three common problems in patients with leukemia. So letter A is the answer, everyone. So very good for those who got the right answer. Okay. Now, your letter B is not the answer because you have osteomyelitis. There is infection going on with that patient. Letter C, generalized rashes. You have herpes zoster, so that's an infection. Okay, so especially if this patient who is on chemotherapy is immunosuppressed, that would be dangerous. Okay, for a patient to be with someone with herpes zoster because that's an infection that could cross over. And of course, letter D, you have your flu. So that's why it's also not the answer. So the best answer to this question, everyone, that's one technique in the NCLEX, is your letter A. And also one tip that I'm going to give you tonight is this. If you have to take care of all of these patients together, if you have to do direct contact with these patients, you always have to prioritize contact with a neutropenic patient. You don't want to go to a patient who's infected and then you go to a patient who's immunocompromised. No, because there is still a possibility of contamination. So always prioritize when you have 4 patients in your unit, always prioritize as much as possible taking care first a patient who is immunocompromised so that you don't spread the infections. And always wash your hands, everybody. Okay? And review your neutropenic precautions in the NCLEX because they ask a lot of questions about that. Okay? Using the mask when entering the room, avoiding raw foods and fruits, vegetables, okay? Avoiding dietary as much as possible inside the room as well. So remember all of those things, everybody. Okay? All right. So let's proceed to the next, everybody. Okay, so review your neutropenic precautions, okay, especially what's the general information about it. And the most common usually is wearing your right PPE, which is your mask, washing your hands, and avoiding raw fruits and vegetables, and also, of course, that's it. Okay, all right, so let's proceed to the next question, everyone. Okay, so congratulations for those people who got right on that question. Okay, so we have our next question, everybody, and this will be the kind of question that you will also have in the NCLEX, something to do with your clinical skills. So every now and then in our Facebook Live, I'll be starting, okay, putting questions on sequence of clinical procedures, because you will have this in your NCLEX, wherein you have to put in sequence the clinical procedures, everyone. Okay, so place the following steps in order when performing tracheostomy suctioning, okay, which is a sterile procedure, of course. So number one, is it placing the client on semi-Fowler's position? Number two, allow 1 to 2 minutes of rest after suctioning. 3, wear or don your sterile gloves. 4, verify the order. 5, suction for 10 to 15 seconds. 6, washing your hands. And number 7, hyperoxygenate with 100% oxygen. So you have to put the numbers. You know what comes first. So you have 7 options. Okay. I know this person over here. Hi, Miss Marilyn. Thank you very much. One of my best managers ever, Miss Marilyn. Okay. All right. So we have, so answer the question, everybody. Keep thinking what comes out, okay, or what comes first in that question. I'm going to give you a little bit of time because I know that most of you are thinking, okay, what will be the sequence for that? So you put the numbers. So you have 7 choices, everybody. So we would like to welcome Benedicta NTS Sagway, okay, and Marie Honorat also. Nimco Coca-Cola, thank you very much for being here tonight. Stephanie Rodriguez, Nimco Coca-Cola, okay, May Agagas, Cristelian Zon, my student right now in the online NCLEX Academy. Jessa Flor Eleuterio, thank you for being here and watching. Okay. All right. So does someone has an answer to this question? I've noticed that it takes a little bit for some of you guys, right? Macon Balcomo also. So try to put your answer, everyone. Okay. So again, this is your tracheostomy suctioning. So what do you think is the best answer? All right. All right. So what will be the best answer to this question? Because you will always have this in your NCLEX. And always remember that when you have clinical procedures, there are standard steps. You know, there's always a standard. Things you should never forget first before you go to your patient and perform the procedure. Okay? All right. Okay. So let me see if most of you are getting the right answer, everyone. Okay, what comes first in this procedure? Okay. All right. It's taking a while for some of you. Okay. I'm seeing some answers here. So let's give a little bit of time for everybody while you're putting your answer, guys. I'm just gonna give you a tip. Always make sure that you of course you properly position your patients. So the question is, do you wash your hands before, or is it the last step? We all know that we wash our hands before and after any procedure, right? So we all do that. So okay, so the answers are coming. I'm gonna give everybody enough time because I know that this is a kind of question that takes a little bit of time to really answer. Okay, so verify your answers, everyone. Okay, if you think you're getting the right answer. All right, so I think we're okay with that. Let's see if everybody was able to put their answers correctly. So remember, everyone, when you're performing suctioning, suctioning does not only remove secretions of your patient. Okay, suctioning also removes the oxygen of your patient. So always remember, a very important step is to hyperoxygenate your patient. But where is hyperoxygenation? In what sequence there? Okay, what you don't have in that sequence will be identifying the patient and explaining the procedure. It's not there. However, sometimes those are the things that are in the question also, or in the choices. So okay, so the answer for this question, everyone, is going to be, all right, so let's see who gets the right answer for this question. So what's the technique? Okay, so the answer is 4613752, everyone. 4613752. Congratulations to all of you. Arlene Hinkel got it right. Very good. Okay, we also have Fresel got it right as well. Very good. Okay, so first, what you're going to do is that you're going to have to verify the order. That is standard for all procedures that you have to do with your patient. You always verify the order first. Okay, verify the order. Okay, is it the right patient as well? Is the order correct? Okay, is it for the right patient as well? So verify the order. That's the number one thing. And when you verify the order, it means that is it a correct order? Is everything complete? And does it make sense? Is it for the right patient? Because sometimes we make mistakes, that the order is carried out for the wrong patient, which is not supposed to be. So be very careful about that. After you have verified the order, of course, you have to prepare your supplies. And then, of course, when you enter the room of your patient, you have to wash your hands. Okay, wash your hands, which is 4, and then 6, and then 1. Okay, place the client in semi-Fowler's position. And after that, number 3, you have to wear your gloves. Okay, and after wearing your gloves, that would be hyperoxygenate with the patient with 100% oxygen. And then number 5, which is suctioning the patient for 10 to 15 seconds. And then number 2, which is allowing the patient 1 to 2 minutes of rest after suctioning. So very good. So most of you got the correct answer in this question, everyone. Okay, so congratulations. But let's review a little bit the steps of suctioning, or in suctioning patients. What are some of the important things that we need to remember? Of course, you verify the order, you identify the patient, you wash your hands, you place the client on semi-Fowler's position. But then don't forget that after you wash your hands, you go to your patient's room, you have to explain the procedure, and then after that, you really need to identify the patient, ask the patient's name with the ID band, okay, and then place the client in a position of comfort, and then after that, you can wear your gloves, and then turn on the suction machine, of course, hyperoxygenate your patient, and then suction the patient for 10 to 15 seconds. Also, one thing to remember in the NCLEX is this. When you are inserting the suction catheter, okay, it's very important not to apply suction. No suction when inserting the catheter, okay? And then you suction the patient for 10 to 15 seconds. Then after that, you withdraw the catheter in a rotating motion, okay, with the catheter in a rotating motion. And when you withdraw the cath, you still apply intermittent suctioning. So when you suction also, it's important to remember that it has to be intermittent suctioning only. So inserting the suction cath, no suction applied, but when you withdraw, you still apply intermittent suction, okay? And then you have to allow the patient to rest 1 to 2 minutes, after suctioning before you suction again. And make sure that you also rinse the suction catheter as well, okay? So, and of course, after the whole procedure, you evaluate the response of your patient, okay? So everybody, congratulations for those who got the right answer to this question. And my number one advice is this: a week before your NCLEX exam, review the most common clinical procedures. A week before, you should start reviewing all of them. In my online NCLEX Academy, I provide resources and I provide lists to students of the common procedures that they need to know before taking the NCLEX exam. Because at one point, when you take your NCLEX, you'll be having questions about proper insertion of the Foley catheter. You have suctioning, for example. You have tube feeding, administration of medication through tube feeding, injections, your subcutaneous, intramuscular. So you need to review all of those, everybody. Okay? All right. So for our next Facebook Live, we're going to have clinical procedures again as a practice, everyone. Okay? And I hope that you will appreciate that. Okay, so let's go to your number 3 question, everyone. Okay, but before that, let's look at the, so we have new people. Denise, Etienne, and Abidemi Sola is also watching. So thank you very much for being here tonight. Now, number 3 question, everyone, is going to be a prioritization question now. Okay, so question wherein you will have 4 patients. So let's see if you can get this question right. Okay, so 4 clients are being seen in the emergency room. Which of the following clients needs immediate intervention? A, the 24-year-old client with cholelithiasis who complains of right upper quadrant abdominal pain after eating French fries. B, the 38-year-old client who reports pain on the right lower quadrant of the abdomen when the left lower quadrant is palpated. C, the 45-year-old client with chronic fatigue syndrome who complains of dizziness and severe tiredness. Letter D, the 57-year-old client who has ascites and leg swelling due to advanced liver cirrhosis. Okay, again, everyone, 4 clients are being seen in the emergency room. Which of the following clients needs immediate intervention? A, the 24-year-old client with cholelithiasis who complains of right upper quadrant abdominal pain after eating French fries. B, the 38-year-old client who reports pain on the right lower quadrant of the abdomen when the left lower quadrant is palpated. C, the 45-year-old client with chronic fatigue syndrome who complains of dizziness and severe tiredness. And letter D, the 57-year-old client who has ascites and leg swelling due to advanced liver cirrhosis. So which of these patients do you think or clients needs to be addressed first or an intervention because something is going on with this patient? Okay, so A, B, C, or D. And then when you have to answer letter B or letter A, for example, I would like you guys to put your rationale. Why is it that you answered letter B? Because that's really very important also when you answer NCLEX question. It's not just because you answered letter B or letter C. I know that sometimes you guess, but it's also good if you really know the rationale why you put the answer, everybody. Okay, we need to practice as nurses, especially that in the NCLEX right now, the focus especially is clinical judgment. The nurse's ability to identify cues and analyze data and be able to decide on what interventions will be the priority. Okay, so very important, everyone, is our clinical judgment and the rationale behind our clinical judgment and our interventions, because that's really very important. So maybe in my next sessions, I'll be discussing a little bit about clinical judgment and why is it very important for the NCLEX. Okay. So, why is it that A, B, C, or D? Why is it not A? Why not C? Why not D? Why not B? Okay? All right. All right. So, is letter B a sign of appendicitis, everyone? Most of you are commenting in the section that it's appendicitis for letter B. However, is that really appendicitis? Your letter B, everybody, the right lower quadrant. Okay? All right. So, let's see, other options are expected outcomes. Okay, so we have referred pain, could be appendicitis. Okay, all right. So welcome Flor de Felipe. So she just joined us also tonight. Mulu Hadera also. Okay, Cherry McIntosh. Hi Cherry, how are you? Gislen Paul is also here. Okay, now always remember that I know that you're all prioritizing right now, but then when you answer the question, content is very important. You know, sometimes there's no shortcut for application and analysis question. You need to have strong background information or core content in nursing so that you'll be able to analyze the question and apply the concepts. Okay? All right. So always remember that you need to have a strong content, everyone. I always tell nurses or my students that don't study only a specific concept. Study as many as you can in your nursing, nursing with your nursing concepts. Okay. All right. So, what's the answer to this question, everyone? Let's see if you're able to get the right answer, everyone. Okay. So the answer to this question is going to be. All right, congratulations. The answer is going to be letter B, everyone. Okay, so letter B, the 38-year-old client who reports pain on the right lower quadrant of the abdomen when the left lower quadrant is palpated. Someone mentioned this. This person is correct. Okay, I think it's Jamel Barsola. He mentioned about Robsing sign. That's correct, because in appendicitis we have what you call positive Robsing sign. So one way to assess and to find out if our patient is having acute appendicitis is to assess for the presence of positive Robsing sign. So the positive Robsing sign is performed by palpating the left lower quadrant, and when the examiner palpates the left lower quadrant, the pain is radiated or referred to the right lower quadrant. So it transfers to the right lower quadrant, and that is an indication of acute appendicitis, everyone. Okay, so very good. That's why letter B is a priority, because that is acute appendicitis. And we need to have immediate interventions for that, because we want to make sure that we intervene before it ruptures. You know, we have to prevent sepsis, we have to prevent peritonitis, we need to give antibiotics, for example. So letter B is the priority because surgery may also be needed. Now, everybody, what are the other signs of appendicitis? Appendicitis is also characterized by, or generally, the initial symptoms of appendicitis will be a generalized pain in the abdominal region around the umbilicus, and then later on, it becomes isolated on the right lower quadrant. Okay? Other signs of appendicitis is, of course, the famous rebound tenderness. Okay, we all know that rebound tenderness is when you press the right lower quadrant and release the pressure, pain occurs. That is your rebound tenderness. Of course, other signs of appendicitis would be leukocytosis, fever, abdominal tenderness, okay, or pain. Those are the signs of appendicitis. Okay, and make sure that when you study acute appendicitis, everyone, be aware of the do's and don'ts. You know, you have to avoid hot water bags, you have to avoid enemas, you have to avoid opioids until diagnosis is made. So there's a lot of do's and don'ts with appendicitis, or especially when a patient comes in with abdominal pain, everyone. So make sure that you know that in your NCLEX. Okay, letter A is not the answer, because cholelithiasis, it's expected that this patient will have right upper quadrant pain after eating fatty foods, which is your French fries, for example. Your letter C, chronic fatigue syndrome, that is expected for them to have dizziness and severe tiredness, because chronic fatigue syndrome is characterized by low levels of cortisol that leads to hypotension and, of course, severe fatigue, overwhelming fatigue for more than 6 months. And then your letter D is not also the answer, because in advanced liver cirrhosis, these patients are expected to have ascites and leg swelling. Okay? All right. Now, okay, what if I change the options? Okay, what about if letter D, I would say, let's change letter D. The 57-year-old client who has ascites, who complains of sudden increase in leg swelling. So that's a different story. Sudden increase in leg swelling, so meaning that something is going on with the condition, everyone. A 57-year-old client with ascites and liver cirrhosis who appears confused. That's a different story, because that could be worsening hepatic encephalopathy. Okay, 57-year-old client with liver cirrhosis who is vomiting blood, because of esophageal varices. So that becomes a different story, everybody. Okay, so there's a lot of ways on how to make a stable patient unstable. But letter A, C, and D, these are kind of like expected with the condition, and that's why letter B comes first, because it is your acute appendicitis, everyone. Okay, all right. Okay, so thank you very much, guys. Hopefully that you got that right. Okay. All right. So let's have all right, so there's a question about my book, and someone asking the question if I'm updating my book in 2021. Yes, okay, updating the book in 2021. That is a plan that we have for this year. However, there's not going to be a lot of changes. Actually, it's going to be more of editing some minor corrections in the book. But generally, I have checked the book, and so far, not really a lot of additions. It's going to be almost the same as the previous editions. But who knows? We may be having some major changes by the end of the year, and I will let you know, everybody. Okay. All right. Most of the common changes in the book, if in case, will be your pharmacology or medications, everyone. Okay, and some treatments as well. So we plan on doing peer review. Okay, in the next few weeks or months, I'll have some people review the book for me, so that we make sure that it's accurate as much as possible for all of you guys. Okay, and I'm also coming up with another book, hopefully by the end of this year. Another book that I plan to come out by the end of this year is your prioritization and delegation book. So I have to find time to sit down and do that, everybody. Okay, but all of the questions that we have here will be in that book. All right. Okay, so hopefully, God willing. All right, so are you ready for our last question for tonight? For tonight, everybody, we're gonna have delegation question. This is the last question for tonight. So let's see if you can answer this correctly. So which of the following tasks may be assigned by the registered nurse, okay, to the licensed practical nurse in a urology clinic? A, explain to the client the effect of prostate hypertrophy on urination. B, evaluate the client's response after a urinary diversion surgery. C, teach the client on foods allowed in the renal diet. And D, assist the healthcare provider during a digital rectal examination. Okay? All right. So which of the following tasks may be assigned by the registered nurse to the licensed practical nurse or LPN in a urology clinic? Okay. A, explain to the client the effect of prostate hypertrophy on urination. B, evaluate the client's response after a urinary diversion surgery. Letter C, teach the client on foods allowed in the renal diet. Or letter D, assist the healthcare provider during a digital rectal examination. Okay? All right. So let's see if you got the right answer, everybody. Okay. Jennifer Marie Griggs is watching us tonight, also watching with us tonight, guys. So thank you very much, Jennifer Griggs. Lisa Sibayan, thank you for being here again tonight also. Alfred Tablada, okay. Flor de Felipe, Richel Mansa, okay. Pratixa Patel, hi Pratixa, how are you? We have Na Ose, okay. Lirayam Kiwas as well, okay. And have your friends visit our YouTube channel. They can watch some of the videos. If you want to have the complete set of all the videos that we have for this Facebook Live, it's all found in our online NCLEX Academy. Okay. All right. So the answer to this question, everyone, I think most of you already put your answer. Okay. The answer is going to be, okay, so let's see. What's the answer, everyone? So the answer is going to be letter D. Very good. I think most of you got that right, and I'm so happy, everyone, that you got the right answer. Okay, you're getting you're becoming experts, on delegation. So we have the answer is letter D because part of the scope of practice of a licensed practical nurse is assisting providers in the, in with procedures. As long as the patient is a stable patient, then the LPN can assist the provider. And this is a simple procedure only. It's only a digital rectal examination for prostate enlargement assessment. So that's okay, or any other reasons why a digital rectal exam is being conducted. Now, okay? So letter D is within the scope of practice of the LPN. Your letter A explaining, remember our acronym, that would be LPNs or RNs are not supposed to delegate teaching, assessment, planning, and evaluation. We call that TAPE, or sometimes we call it EAT, evaluation, assessment, and teaching. Very good. So letter A is teaching, so we avoid that. Letter B, evaluation, of course, no. And then letter C is teaching the client about the diet, then of course, no also. So for the LPN, that would be letter D. LPNs can reinforce teaching, okay? However, they cannot perform complete teaching, especially discharge teaching or teaching clients for new diagnosis or for procedures. So the answer is going to be letter D, everyone. So congratulations, okay? And I would encourage you also, everyone, to use other resources, not only my resources, but also other resources. There's a lot of books there on delegation and prioritization so that you solidify your knowledge and your critical thinking when it comes to prioritization and delegation. So I really encourage you to read a lot of practice questions, everybody. Okay? All right. So we do have another person. Okay. So CG Byrne. Now, guys, you're passing your NCLEX. Hopefully, you can make a recommendation in Facebook. CG Byrne, can you please do a Facebook review for me, please? Thank you. Okay. But then CG Byrne said that, thank you, Mr. Matus. I just watch constantly your YouTube and live. I passed my USRN NCLEX last month. Prioritization, delegation, and mechanical ventilators. Very good. Okay. So congratulations. Okay, very good. So don't forget also your mechanical ventilations, guys. Okay, or your ventilators. Simple management of how to manage ventilators. What's their function, and of course, the different sounds or alarms of the ventilator. But always remember, as nurses, be aware of your scope of practice in terms of ventilator management, okay? Because there are some practices or tasks that need to be done only by respiratory therapists in terms of ventilator management. So be aware of that, everyone, okay? All right, so congratulations. We have like 2 persons who told us tonight that they passed the NCLEX. So congratulations, okay? So very good. And you know what? When you're attending these sessions, actually, this is one way for you to improve your critical thinking or your clinical judgment, okay? This is one way for you to have that ability to apply your concepts or your content into the situation. So that's really very important, everyone, okay? That we answer the questions together, that you feel challenged as well on how you apply this. But again, remember, everybody, I'm telling you that you need a very strong content, okay, before you can tackle difficult questions. And that's why I always tell students, I provide you strong content. But then remember, when you're using UWorld, for example, you need to have a very strong content, okay, so that you enjoy answering practice questions. Okay, so just very quick, everybody, before I end for tonight, just to kind of let you know, we do have our live webinar classes. Check out our website, Matus Nursing Review Online NCLEX Academy. We have schedules there for live webinars. We have another session coming up in January 30 to April, I guess. So we have the 10-day live webinar coming up in January 30. So that's live webinar every Saturday. Now we also have the Tuesday, the 12-week fast track NCLEX review from 6:30 to 9 p.m. So we have a lot of programs, live webinars, and also self-studies. So feel free to check our website, matusnursingreview.com. So in our Matus Nursing Review Online NCLEX Academy, the workbook is $94.50 if you order that. We do ship also internationally, and then you have the option of subscribing monthly, which is going to be $49 only. So it's a highly affordable NCLEX review for students. This is our way of helping students not to spend a lot of money for your NCLEX review, everyone, okay? So if you can have your content, and complete, and it works for you, then that's good. I always tell students also that you can go to the website and then you can enroll, and then if it's for you, then continue using it. But if you feel that it is not for you, then that's okay as well. We have a 30-day money-back guarantee as well. Okay, so another one, everybody, we have the of course, our beautiful t-shirts. So if you always want to get reminded and get inspired and I really remind students not to give up. So this is a very nice t-shirt that you can buy from us as well. So very nice message. It says, I can do it. So visit our website. You can purchase this sweatshirt for you, everybody, or the sweater for you guys. Okay. And congratulations also for last week. You know, we announced our winner was Tan Pham. So congratulations, Tan Pham. He already enrolled in the online NCLEX Academy. So hopefully this will help you pass your NCLEX or licensure examination. Okay. So again, thank you very much, everybody. Okay, all of you guys, I'll see you again next week, and we will have exciting questions for you. Okay, so coming up in the next few weeks possibly will be dosage calculation. Are you excited about that, everyone? Dosage calculation, and also more labs, everybody. Okay, if you want to have the complete set of all these videos, you can find them in our online NCLEX Academy. Everything that we have done ever since this year, everything is the online NCLEX Academy, everybody. Okay, so thank you very much, everybody, and have a good night.